Welcome to Fast and Furious MCQ edition. Salter-Harris fracture. The Salter-Harris fracture is the classification for the fractures which are occurring at the growth plate. Normally the bone will be, we are having this epiphysis and this is metaphysis, and it continues as an physis or the diaphysis. In between the epiphysis and metaphysis, we have this growth plate. There is a growth plate. This is a normal structure of a bone. The upper end is the epiphysis, and in the long bone we have both the epiphysis present both at the upper end and at the lower end. For example, this is the diaphysis ends, and we have a growth plate here, and this is the metaphysis. So we have the metaphysis on both the ends with the growth plate in between, and the next is the metaphysis, and this part is the diaphysis. And Salter-Harris fracture classification is the growth plate fracture classification, and we have 9 types in the Salter-Harris classification. Among that, first 5 is the most important and 6 to 9 is the rare form. We learned this first type 1, 2, 3, 4, 5 types of Salter-Harris fracture. The type 1 fracture is through the growth plate. Here type 1 remembers that there is a one horizontal line, single or a one horizontal line, and that line is through the growth plate, and that is called the type 1 Salter-Harris fracture. And example of this is slipped capitate femoral fracture. And in case of type 2 Salter-Harris fracture, which is the most commonest fracture, it involves 2 lines, one horizontal line and one vertical line will be there. Here type 2 stands for 2 fracture lines, one horizontal line and one vertical line. This horizontal line is as same like type 1 is through the growth plate, and this vertical line is through the metaphysis. And this forms a fragment, and this type is called the type 2 Salter-Harris fracture, and it is the most common type of fracture. An example of this is we are seen in the supracondylar fracture and fracture of the phalanges, or the examples of type 2 Salter-Harris fracture. In case of type 3, there is as like type 2, we have 2 fracture lines, one horizontal and one vertical, but we obtain 3 segments of the fractured bone. One horizontal segment is through the growth plate, and the vertical fracture line is through the epiphysis. So we get 3 fragments, 2 epiphyseal fragments and one remaining part of the bone. So type 3 have the 3 fragments. And we have the type 4. In the type 4, the same, we have the 2 fracture lines, but the fragments are 4. When we have the 4 fragments, then it is a type 4. One through the growth plate, which dividing the metaphysis and epiphysis into 2, and the vertical line is longer, and that separates both the metaphysis and epiphysis. So we have 4 segments. This 1, 2, 3 and 4. So 4 segments is seen in the type 4 Salter-Harris fracture. And in the type 5, it's a axial compression fracture. Due to pressure from both the ends, there is a compression or the crush injury of the growth plate. It is most commonly seen during a fall from the height. So the growth plate get compressed. This is the type 5 fracture.